Hi, everyone. Welcome back to the podcast. Welcome all new listeners and welcome back to those who heard my content in the past. If you want to know what are three ways or three tips to improve your evaluation of athletes, you have to tune into this episode. Before I go on to the podcast, what is new? What is better in life? A lot of hosting of friends and family. I feel like we've had 4 straight weekends of fun with friends, but also organizing events. We are a very social family. We enjoy hosting. We enjoy spending time with those that are close to us. And I'm truly passionate about it. My wife is really the social butterfly. So it's been absolutely busy every single weekend. Go, go, go. But other than that, fitness is good. I'm back on, just beat up and sore, back to the normal routine. I did 7 days last week. I'm back to it. So now it's just maintaining it. So that's great. My kids started school. Everybody is in the grind. Everybody's in the routines. So it's fantastic. And yeah, just enjoying the time with my wife and getting some projects going that I'll announce in the near future with some new programs and courses. So yeah, other than that, life is fantastic. All right, let's get on to this podcast. What are we talking about in terms of evaluating athletes? So there's so many ways that I can help support physical therapists in their treatment, their evaluation, everything else. I wanted to have a conversation about three unique things that you might not be doing already, and I have nothing to do with any form of CEU course that you'd have learned. This is behind the scenes of what are the nuances, what are the three things that really set good clinicians apart from those that are learning, that are developing? What are some little tricks and things that you can be adding into your current arsenal, your toolbox, that you most likely aren't doing right now? And this was not even a conversation that I was having with anybody or a mentoring session. It's what I observe, it's what I see in my team. It's what I see in giving feedback to others. It's what I see in developing leaders and developing clinic managers or people who have direct reports. And I enjoy teaching. I truly do. I'm very, very passionate about it. I enjoy the aha moments. I enjoy having people think differently in a way that maybe opened their horizon, maybe didn't think that it was possible, just to open up so many new doors. And that to me is very powerful. And I'll tell you why. When I was a kid, I grew up in a very economically challenged background, and there was times where we were pretty poor, and I there was a time where we would the only way that we would be able to eat is if we literally went behind dumpsters in stores and grocery stores. And during that time, I learned about people who were willing to help. I could have been probably 10, 11, 12 years old. And I learned about people who on the surface looked like they wanted to help me. And then I found people who genuinely wanted to help. And if I can point out what are the things that I felt, the things that, when you're in a very tough situation, you're very skeptical of people trying to help you. And that it's translated so much into my PT school and me being a practitioner out of school. I was very skeptical. Yeah, I would take people's help, but ultimately I realized I had a challenging time just in my own like personal life that made me skeptical of taking feedback or listening to other people. And the thing that that context, that situation, that scenario in my life gave me was a lot of situational awareness and reading how people view me as a physical therapist. You're always trying to help people. You're always trying to figure out what is the thing that they're looking for that maybe they haven't been able to solve with other physical therapists or other healthcare providers. And for some people, it's being heard. Some people, it's the skill that nobody else had. For others, it's your ability to create targets for them. For some people, it's your personality. And I enjoy working with every single athlete possible. And there's three things that uh, athletes have told me that they truly enjoy during our sessions. And what I see in a lot of successful physical therapists, maybe they don't notice it, they don't talk about it, but ultimately it's in leaders, it's in people who are very successful. And so these three things come from my childhood experiences, translating over to managing people and their expectations and who they are in the clinic. And for some of you, uh, you may struggle with this. You might do very, very well with it, but ultimately, they're critical things that PT school doesn't teach you, and you need to be aware of them if you're really looking to up your game with being able to manage people and being able to get outcomes that maybe other people haven't been able to, and you want to be that person who does it. And so I'm going to share this because I've seen it with leaders on my team. I've seen it with leaders in the industry. I've seen it with my own personal mentors, and it's a very interesting number of characteristics. And I'll open with that, and I'll share with you. So the first one is to listen. And what I mean by that, it's not like what people are saying. They're like, they're doing their history. They're talking about their subjective. They're working through, how they develop pain and all these other things. But the thing I listen to is definitely the words that they use and choice of words to describe what they do. But the most interesting thing that I really appreciate is listening to tone, why people choose to inflect, why people choose to emphasize certain words because they're very passionate about that. And so I'll listen for tone as somebody's talking to me. They have high energy, they have low energy. And when you respond and you say, what questions do you have or whatever it is, and you can see a very low tone, or a very very stagnant, very uh, calm response. And what that tells you is they are not in line with what you're talking about. There's clearly something missing. So if somebody has a very low tone, they're not engaged. And so if you have somebody with low tone at the end of a session and you're at the initial evaluation or a session, you're like, oh, that was a great experience. Here's all the things you need. Do you have any questions? They're like, no, something happened that you didn't pick up on during the session or during the end that limited their ability to connect with you. And what that does is you're like, oh, why is this such a big deal in clinical practice? Well, whenever you have 6 to 8 visits or 10 to 12 visits or 15 to 18, whatever the number of visits are, you only have that much time to develop that relationship and most importantly, create those outcomes. And every single time that you have with them, you got to make sure that they have everything that they need, all the resources, all the questions answered. Because if you're seeing them once a week or you're seeing them every 5 days or whatever it is, that's lost time for clinical outcomes. And if you have an athlete who has an event coming up or they have an important race and that time is critical, every session you have to treat it like it's the most important thing to get to the next stage. And every session builds off of a platform to get to the next step. And when you have sessions that are mediocre, I will say, you ruin an opportunity for them to gain progress inside what they're trying to achieve. And so every session, I'm making sure that they understand everything. And I base it off a couple things. And one of them is tone. I make sure that my sessions are high energy. They totally get it. They're with me. And you might be like, well, that's their personality. Absolutely. But if it's the tone is consistent across the session, gosh, that makes sense. But if you start to see low tones when you're closing out or you're giving home programs that just don't seem motivated, they seem confused, that's when you have to address that. One of the things I'll do right away is I tack the elephant in the room and I'll give them an opportunity. If I feel that with the tone, then I can say, listen, I want to make sure that this session you understood everything and you are ready for the next. Because every piece of this, every session is a building block onto the next. And it's very critical that you have all of your questions answered and you feel 100% confident that you know what you need to do for the next session. Pause. Follow that up with, what questions do you have about your plan, your exercises, or anything we discussed in this session to prep you for the next. And give them about 15 to 20 seconds. And it's very awkward to give that silence. With somebody with low tone and you offer that, they'll just process everything you just talked about. And so it gives them an opportunity to digest everything you just said and really speak the important pieces that they've wanted to. And I promise you'll get somebody to open up more than you thought. And it's the thing that I've noticed in working with athletes of all levels, community members, whatever it is, that tone tells you a lot. And the response that you get, the energy, the inflection, and everything that you do. And so it's a chance for you to finalize and to not waste time in between sessions. And I think that's a critical part for physical therapists to understand is that every session matters and it counts. And so that's one little piece that you can be doing just to upgrade the little things that you do in clinical practice. So if your exercises were on point, your progressions were on point, your manual therapy was on point, your taping was beautiful, and then you see their tone changes throughout, it gives you insight into something else is missing. And before you blame it on their compliance, before you blame it on the home exercise being too aggressive or whatever it is, it's your chance to answer it right there and then. So tone is number one. And then number two is so the first one was listen, right? So I'll listen to individuals and I'll peek my head into sessions that I have my team, where they're working with athletes, and I'll peek my head in and I'll just kind of listen to sessions. And I like to listen because it tells me engagement, and I won't watch a session because that helps bias, right? Somebody's smiling, that's fine, but I want to see how they speak. I want to see what the energy is. And so I'll run sessions and I'll just listen and I see tone. I see, that person was confused. That person they got it. That was a great session. And that's part of being a mentor is being able to realize that you have to be a well-rounded clinician, not just in the skill set you have, but your people management, your leadership development, your ability to progress people, your ability to read people, your ability to navigate a lot of different challenges. And so listening and listening to the words that people use and their tone is very critical. In addition to that, I'll listen first. And the second part to this is the second tip is to watch how people respond or interact with you. There's two different pieces here. Facial expressions is very, very huge. It tells you so much about how people process what you're saying or what you're doing. There's a personality type that we call expressive. Expressives they're very emotive. They share how they feel with the facial expressions that they have. And those people are easier to read because they feel like engaged. As long as you're smiling, you're moving your head nodding, you're moving your eyebrows. It's very, very important. What you'll see is that they'll copy you, they'll just mimic you, right? And so that's very easy to read. It becomes very, very challenging when someone's a little bit more stoic. Somebody is not as expressive. And so your job is to figure out, can you pick up on anything else with their facial expressions, their smile, their ability to communicate with their face. And that's very, very important. Most people communicate with their facial expressions, the words that they use. And then the last one is their body language. So with facial expressions, just watch their eyebrows, watch their smiles, watch the facial expressions they provide, and it tells you, are they grasping really what I am talking about, and or are they overly expressing that they get it and they have no idea what they're doing or saying. And so when you have somebody who is very expressive and they're mimicking you, the thing I'll support that with is if you're doubting, gosh, this person seems so highly engaged, I always ask people to summarize what I just said in the context of, if they're going to tell their spouse, significant other, mom, dad, whatever it is, how would you describe what the plan is for physical therapy to hit your goals? What did we just talk about across in this entire hour? What is it that you would say to your parents, your significant other, on what our plan is, so that I can have an understanding that I know you know what this entire hour was about? And some people will be stumped. And the people who are overly expressive, they have that good, big, huge facial expression that you thought that they knew what they were talking about or listening, and they actually don't know what we just talked about. And at that point, it's very critical that you lost the communication somewhere. And I think it's very important for physical therapists to understand. A lot of times we expect that people are going to listen to us. We expect that they're going to just pick up on everything, that they're going to grasp everything. Think about this, right? You've spent a large portion of your life going to school for a very special niche skill. And these people have their own jobs, their own lives, and you expect them to digest an hour's worth of crammed information and being able to relay that, remember it, and then demonstrate it at home. And that's very, very difficult with anything that you've ever done in your life. Whether that's maybe you talk to a mechanic in your car and they talk about what was happening with your tires or whatever it is, or your accountant or your dentist or whatever it is, and you're like, yeah, I don't know, I just want to get my teeth cleaned, I just want my tire fixed, I want whatever it is. And that's what happens when people come in, and ultimately you just want to understand that they grasp everything that they do, that you just communicated. And if you don't, it was worth nothing. And that's very hard for physical therapists to understand, that you expect, well, you drove here, you went to see your doctor, you got a prescription, you're the one with the pain, so you're the one that's going to do it. And if you don't want to listen to me, that's fine. That's not how it works. You're here to provide a resource so that people are set up for success. And so when you understand that, it's not their fault. They didn't go to school for X amount of years, and that's not their priority. The priority is like, literally, I just want to use my shoulder. I want to be able to comb my hair or brush my teeth or whatever it is. And when you use fancy words that, that you're not listening to their tone, you're not listening to their body language, and that doesn't set them up for success, you as a physical therapist have failed, not the other way around. And when you're in the service industry, when you are in customer service, when you are all about patients and helping people, the skill is not the service. The ability to get them the outcome is the service. So when you deliver a skill with complex information and you don't listen to them and you don't watch if they actually retain everything and don't ask them, you don't know if it made sense and if they understand and they are going to execute on the plan. So the first one was to listen. The second was to watch both her facial expression and body language. So here's an interesting one. If you've ever watched, if you ever worked with an athlete or a patient, one of the things that you can do inside a session, something called mirroring, like a mirror. And the body language that you exude or you have is what the other person sitting across from you will. So if you are slouching and you are not confident about a session, guess what? They will mimic that, and their tone will also express that as well. So you, as a physical therapist, now have to lead by example. And so one of the things you can do is not have an overpowering posture. You don't want your hands in your pocket. You don't want your hands across your chest. One of the things you can do is have an open posture. Use your hands and everything to communicate, to have an open and welcoming environment, and that allows people to embrace that as well. And so when you see people who are slouched and they don't seem engaged, guess what? They're not. So let's put this all together with somebody who has low tone, poor body language, or poor posture that demonstrates disengaged body language with no facial expression. You have somebody whose outcomes are already going to be limited. And so your job is to figure out, if you truly listen to the words they're using, you listen to their tone, you're watching their body language, and you see their facial expression, your job is to figure out, well, great, I don't have somebody who's engaged. Now I need to be able to do that. And if you rely simply on the skill, on the exercise, on the tape, on everything else, you're only doing a piece of that customer service. You're only doing a piece to achieve that outcome. And when you put it all together, and you can get somebody to understand and answer the question, what out of all of that did you understand? And what are you going to tell your family when you go home about your plan? And you can get somebody who's excited, get the tone high, their body language is good, their facial expressions high, they got a lot of smiles. You now have your ability to produce a higher income or outcome is going to be significantly improved. And that is the fun part to me as a physical therapist. I enjoy when patients and athletes are at a point where they enjoy the session, and they come to me with, the excited facial expressions. The body language is great. The tone's great. They come in with high energy. We all love those people. We all love those athletes. And you're like, I just want more of them. Well, you have to learn how to develop them as well. And that comes from the initial evaluation all the way through follow-ups. And it all starts with initial evaluation. And there's many. I've done several courses on this. I've taught courses on these type of things. I've mentored physical therapists on this, and I enjoy the psychology of developing relationships because at the point when I was young, I was very skeptical of people, and I learned that I learned to read who was trying to help me and who wasn't. And out of all of those traits, I realized it was the ones who had a genuine tone, that had an open, warming body language, and they were just constantly trying to help. And I see it, like I could feel it. And you've done that before. You see people who are genuinely interested in helping you, and if you don't exude that when you're working with people, they're also skeptical of you. And that already is limiting your outcomes. And you need to understand that no form of manipulation or mobilization is going to change that, except your ability to communicate with people and develop those relationships. So, number one was to listen. Number two was to watch. And number three is to set expectations. So, I put in here, you have to learn how to do two things. This would be like 3A and 3B. Number one is you have to learn how to direct conversations, and 3B is to set the expectation. They go together. So especially when we work with athletes at a very high level, pro athletes, every part of their body hurts. And they train so often that they are constantly injured. And your job as a physical therapist is triage and say, what is the biggest priority? Where can I get the most bang for my buck on? If I improve this low back pain, it'll help the knee pain. If I improve the knee pain, how does it help the neck pain? Or if I have hand pain, how do I manage 8 different body parts inside one plan of care or one initial evaluation? And athletes have been seen by many clinicians, and they will learn to read what you do, how you do it, and if they've been to numerous clinicians, they know how to work a session. And what I mean by that is they will try and get as much squeeze as possible per session. And your job is to figure out, what are the 2 to 3 body parts that I can work on that are really going to maximize this person's outcome. And so when you come into that challenge, your goal is, okay, they have all of these wants, right? But you're the person who has to figure out what their needs are. So you have to balance those out, wants and needs. And young clinicians or inexperienced clinicians or clinicians with low confidence about their clinical skills will get lost because they will try and accommodate everything that athlete's trying to ask for. And that's when you can always pick up on a inexperienced clinician or a younger clinician. They're just trying to, they're a people pleaser. And a people pleaser doesn't increase outcomes. It increases the satisfaction of the service, but it doesn't produce long-term outcomes. And why? Because you're not achieving the most important things, which is get rid of the back pain, get rid of the knee pain, get rid of the neck pain. If you're trying to attack everything, you'll have a diluted session where you're trying to work on too many body parts and not enough to have enough time to devote on the most important things. So if you find yourself lost, try to accommodate pro athletes. It's because you're allowing them to drive the session. And the third tip I can tell you is you have to learn how to direct conversations so that way you can target. So whenever an athlete comes in, they're like, oh, but my knee, and oh, my shoulder, and oh, my back. The first thing I'll tell them is, I completely understand that my job today is to figure out the top two body regions that are going to maximize your outcomes. Yes, we can look at all the other things, but today I'm going to have time for 2. So will you choose your top 2 priorities right now? And what that does is now it gives them opportunity to say, they get to triage, they get to have a say inside their care. So, if you're looking to help athletes and have them understand that you know what you're doing, you have to be able to do all 3 things here. You have to be able to listen for their tone, the words that they use, and when they use them. Number 2 is watch their body language and facial expressions. And number 3 is direct the conversation to be able to set the proper expectations. And when you do that, you have athletes who listen to you. And I know that might sound easy, but athletes who respect clinicians, and they will say whatever that clinician, he or she says, is what I'm going to do. And you earn that respect because clinicians those who are overly welcoming and they work on, appeasing everybody, they might not be able to get the same outcomes. Athletes, they want a warm, welcoming environment, but ultimately they're looking for outcomes. Is the most important thing, especially if they're pro athletes. They really don't care about how nice you are. They want the outcome. Now, the way to maximize this session is to create this environment where you totally get where they're coming from, what their priorities are, and you can really create an environment where athletes feel taken care of, they feel heard, they can be themselves, and you still get to set all of the boundaries. And inside a session, that's what they're looking for. They're looking for a coach, they're looking for a mentor, they're looking for somebody who can support them throughout their career with their aches and pains. And that's no different, right? So athletes have a track coach or a basketball coach or a soccer coach, and you're pretty much their health coach. And that's the way you need to see it, in that some of the best coaches that you ever had as a kid, as an adult, in playing in college or high school, they listened, but they also gave you direction. They were firm and stern when you needed it, but they were great listeners. They could read what your situation was, and somehow they knew something different about you. And that is very applicable to physical therapists. And as I've worked in professional sports, I've seen really good coaches. I've seen really good strength coaches. I've seen really good healthcare providers. And these are huge, huge tips and things for you to include, not just in your initial evaluation. It starts at the initial evaluation, but then throughout every follow-up visit. And where things get set, where expectations get set, and you can help direct the conversation, is on the initial evaluation. So include these 3 tips to be able to set yourself up for success and maximize your outcomes, because that's what we're trying to do. And it's the 3 things that I've learned from my childhood, from working with fantastic mentors, from being in a residency, from working in pro sports, from working with some of the best athletes on the planet. It's the 3 tips I can tell you right now that will set you apart from other clinicians, no matter the setting, whether you work in a high school with an athletic trainer, or you work in a hospital, or you work in a local school, or you work in a university or a high performance center. Whatever it is that you have, these qualities, people are people, and that's what you have to understand. You service people, not patients. And when you do that and you treat them accordingly, your outcomes, you now have a better chance with the skill set that you do to maximize those outcomes. So I had to share. It was this is a big deal to me. I really appreciate supporting people throughout their career, both athletes and rehab professionals. So wherever you are in your career, I hope this helps. This is a big one for me, just because I recently saw a couple of my team members implementing these things, and feedback that I've given them, and I want to be able to share with you guys inside your career. So there you have it. You guys are absolutely loving these things, and you feel like you are stuck in your career, or you want to continue to upgrading it, and you need support, you need what else am I missing, what other things should I be adding onto my plate. These are the type of things that I cover inside my Sports PT Academy. It's it's a small group of mentorship with clinicians all over the country, and it's all virtual, and it helps people understand the context of what you do. Sometimes we get stuck inside the taping job, and the mobilization, and the scraping, and the cupping, and the whatever you want to call your assets, your skills that you have. But those are all great tools, and when being able to use them is the art to really putting a session together and being able to help athletes all year round, not just with initial evaluation or with pain relief, moving them on to strength and conditioning programs. You're going to get stuck inside your career, no matter if you've been practicing for 10 years, 20 years, or 2 years. And if you are stuck, or you want to continue refining those things, it's time for you to join my Sports PT Academy. If that's of interest to you, send me an email, Dr. Chris at drchrisgarcia.com, or head over to the website. It's drchrisgarcia.com/academy. That gives you a great chance to be with other clinicians who are having the same challenges you are, and really taking that to the next level. So there you have it. I hope you guys get something from this, and it improves your clinical practice. Send me an email. Let me know how amazing it is. Send me a direct message on Instagram. Nonetheless, I hope you guys are doing fantastic and staying healthy and enjoying and living life. So I will see you guys on the next episode. Take care.